I'll never forget the day my 6-year-old great-granddaughter looked up at me with those innocent eyes as I struggled to get out of my chair. "Grandpa Doc," she said, "why do you make that sound when you stand up?" "The sound like our old dog made. Before he went to heaven?" her mother gasped, but I just smiled. Children have a way of speaking the truth we adults try to hide, don't they? That groan of pain had become so normal to me, I didn't even notice it anymore. But she did, and it made her think of our beloved family pet in his final days. I looked around the room at my family gathering, my children in their 60s, grandchildren in their 30s, all averting their eyes in that moment. They'd grown accustomed to seeing me this way too. The once strong family physician who delivered half the babies in our town now wincing with every movement. Is that how your family sees you now? Have you become the person everyone needs to wait for, the one who can't join the walk to the lake, who needs the special chair? The one they love but privately worry about. The one making those involuntary sounds of pain that even a child notices. I'm Dr. Harold Winters. I turned 91 last spring, and I've been practicing medicine for nearly 65 years. While most of my colleagues retired to Florida golf courses decades ago, I've kept a small practice going 3 days a week, not because I need to, but because I believe my greatest value comes from living through the same challenges my patients face. You see, I don't just treat the elderly, I am elderly. I've felt joint pain from the inside. I've experienced the frustration of doctors half my age patting my knee and saying, "Well, that's just part of aging," before rushing to their next appointment. I've tried the pills that upset my stomach and the creams that stained my clothes, just like you have. And like many of you watching, I've lain awake at 3 a.m., shifting positions, wondering if this is just how life ends, in a gradual surrender to discomfort and limitation. What I'm seeing in my practice now breaks my heart. Wonderful people, teachers who shaped generations, veterans who served our country, mothers and fathers who built everything we enjoy, now feeling like burdens to their families because of relentless back, knee, and joint pain. Just last month, Eleanor, an 83-year-old former librarian, told me she'd stopped attending her granddaughter's soccer games. "The bleachers are too much, Harold," she said, using my first name as old friends do, "and I can't bear the look on my daughter's face when she has to help me up and down." Then there's Robert, 79, who built houses his entire life. Strong hands. That could frame a roof in a day now can't hold his coffee cup without pain. The worst part isn't the pain, he told me. It's feeling useless. And Margaret, 87, who whispered to me during her checkup that she'd started wearing adult diapers. Not because of incontinence, but because the bathroom was upstairs and her knees couldn't make the journey in time. These stories stay with me, because I know that behind each one is a person feeling increasingly invisible, increasingly burdensome. A person like you, perhaps, watching this video alone in your home, wondering if anyone truly understands. Here's what your regular doctor probably hasn't told you. What you're experiencing isn't simply wear and tear or old age. That explanation is both incomplete and frankly lazy medicine. What's really happening involves your body's fascial network, a connected system of tissue that runs throughout your entire body like an internal bodysuit. In our younger years, this fascia is flexible and hydrated, but as we age, it becomes rigid and develops adhesions, like a sweater that's been through the dryer too many times, shrinking and hardening. When this happens, pain doesn't just stay in one place. A problem in your foot can create pain in your back. Tightness in your hip can manifest as knee pain. It's all connected in ways medical specialties, with their focus on isolated body parts, often miss completely. And here's what might surprise you: the feet, yes, those appendages we barely think about until they hurt, contain nerve endings connected to every major organ and joint system in your body. They're like the circuit board of your physical well-being, yet most of us have stuffed them into ill-fitting shoes for decades, cutting off proper circulation and nerve communication. This isn't your fault. No one taught us this. I went through medical school in the 1950s, and we had exactly 2 lectures on feet, both focused on diabetic complications, not on their role in whole-body health. Before I share the solution I've developed, one that's helped hundreds of my elderly patients reduce or eliminate their pain without drugs, I want you to understand something important. It's not too late. Your body has an astonishing ability to heal itself when given the right support. Even in your 70s, 80s, or 90s, what I'm about to share with you is simple, can be done at home with minimal cost, and many of my patients report feeling significant relief within just 7 days. It doesn't require special equipment, strenuous exercise, or contorting your body into positions that might be uncomfortable or dangerous at our age. In fact, the core of this approach involves applying a special patch to a specific region of your foot, a region that, when properly stimulated, can release tension patterns throughout your entire body, improve circulation to painful joints, and reduce inflammation naturally. Let me walk you through the complete protocol I recommend. To my patients, step 1, prepare the reflex zone on your foot. This is the foundation of everything that follows. Each evening before bed, soak your feet in warm water with 1 cup of Epsom salts for 15 minutes. The magnesium in the salts will be absorbed through your skin, helping to relax tight muscles and reduce inflammation. If bending to reach your feet is difficult, use what I call the towel trick. Place a small towel at the bottom of the basin before adding water. After soaking, you can use the ends of the towel to dry your feet without bending. While your feet are soaking, gently massage the arch of each foot with your thumbs, or, if reaching is difficult, use a tennis ball under your foot while seated. Press firmly but not painfully, making small circular motions. This begins to stimulate the reflex points and improve circulation to the entire fascial network. Why does this work? Your feet contain approximately 7,000 nerve endings each, many of which connect directly to your spine, hips, and knees through neural pathways. When we stimulate these pathways, we're essentially rebooting communication lines that may have degraded with age. Step 2. Apply the therapeutic patch to the master pressure point. After your feet are dry, it's time to apply the therapeutic patch. You can purchase these patches at most health food stores or online. Look for ones containing capsaicin, wintergreen, or menthol. If you're on blood thinners, avoid patches with ginger or turmeric as they may interact with your medication. The critical location for the patch is what Eastern medicine calls the kidney 1 point, located in the center of your foot pad, just below the ball of your foot, in the soft depression you'll feel when you curl your toes slightly. This single point connects to your entire spinal column. Place the patch directly on this point on both feet. If you have trouble seeing or reaching your feet, use a handheld mirror placed on the floor or ask a family member for help. For those living alone, I recommend what I call the sock method. Place the patch sticky side up inside the sock, where it will contact the correct point, then carefully put the sock on. Leave the patch in place overnight. While you sleep, the active ingredients will be absorbed through this highly permeable area, traveling through your neural pathways to reduce inflammation and pain at its source, not just masking it as pain medications do. Step 3. Morning. Activation and movement protocol. In the morning, remove the patches and dispose of them. Before placing your feet on the floor, take 1 minute to activate the treatment area. Using your thumb, press firmly into the same kidney 1 point where the patch was placed. Hold for 3 seconds and release. Repeat 10 times on each foot. Next comes what I call the century roll, a gentle technique to maintain the fascial release you've initiated. Still sitting on the edge of your bed, place a small bottle of water or a wooden rolling pin on the floor. Slowly roll the arch of each foot over this object for 1 minute. This continues to signal your nervous system that relief, not pain, is the new normal. Now, when you stand up for the first time, your weight will further activate these pressure points, sending healing signals throughout your body. Many of my patients report that this moment, the first steps of the morning, is when they notice the most dramatic difference, often within just 3 to 5 days of beginning the protocol. For those with severe back pain, there's an additional afternoon step. After lunch, place fresh patches on the same points for 30 minutes, while elevating your feet slightly on a footstool. This booster session helps maintain the pain relief throughout your most active hours. Let me tell you about Vernon, an 85-year-old patient of mine who came in using a walker after a lifetime of farming had left him with debilitating back and knee pain. Medications had caused stomach bleeding, and his children were pressing him to move to assisted living because they feared he would fall. Vernon was skeptical about foot patches, as he called them. "Sounds like snake oil, Doc," he told me gruffly. But he trusted me and agreed to try the protocol for 2 weeks. 10 days later, his daughter called my office in tears. "Dad walked to the mailbox yesterday," she said. "He hasn't done that in 2 years. When Vernon came for his follow-up, he left the walker in the car and walked into my office with just a cane. 'I'm not dancing yet,' he joked, 'but I'm thinking about asking my wife to the senior center social next month.' 3 months. Later, Vernon sent me a photo of himself standing unassisted in a trout stream with his grandson, fishing pole in hand. 'Worth more than any pill,' he'd written on the back. Then there's Dorothy, 92, who had resigned herself to watching her great-grandchildren from the window when they visited because her knee pain made it impossible to join them in the yard. After just 1 week on the foot protocol, she was able to sit on the porch steps with them. By week 3, she was walking slowly to the garden to show her youngest great-granddaughter how to tell when a tomato is ripe for picking. They used to visit out of obligation, she told me, dabbing at her eyes during her checkup. Now they come because we can do things together again. They stay longer. Harry, that's worth everything to me." Perhaps most moving was James, a 79-year-old widower whose back pain had become so severe he rarely left his apartment. "The pain was my only companion," he said during his first visit. "We started the protocol, and I made sure he had help setting it up for the first few nights. 3 weeks later, James called my office. He joined a senior walking group at the mall. 6 weeks later, he brought cookies to his appointment, baked by a woman he'd met in that walking group. "Doc," he said with a smile I hadn't seen before, "turns out pain isn't the only thing that can disappear when you're feeling better. These stories matter because they're not about temporary pain relief. They're about lives reclaimed. Dignity restored. Connection and joy found again. I want to be very clear. I'm not promising miracles or instant cures. What I am offering is a gentle, natural approach that works with your body's own healing systems that are still very much alive and functioning even after 70, 80, or 90 years of life. This approach won't make you 20 again, but it might help you enjoy being the age you are now, with less pain and more capability than you currently believe possible. Remember my great-granddaughter's innocent question about why I made those pained noises when I stood? 3 weeks after, beginning this same protocol myself, she noticed something had changed. As I got up to help clear the dinner table, something I couldn't have done before, she looked at me with wide eyes. "Grandpa Doc," she said, "you didn't make the dog sound." The entire family laughed, but my son-in-law's comment later stayed with me. "Dad," he said quietly while we washed dishes side by side, "it's good to have you back. That's what I want for you. To be back in your own life. Not just physically present, but actively participating. Joining the conversation instead of enduring it from the sidelines. Creating memories with your loved ones instead of being the person everyone worries about. Try this protocol for just 7 days. Give your body this small gift of attention and care. The patches cost less than a copay for most prescription medications. The entire process takes less than 15 minutes of your day. What do you have to lose except the pain that's been limiting your life? I've spent my career, my entire long life, seeking ways to help people feel better. At 91, I can tell you, with absolute certainty, it's never too late to reduce pain. It's never too late to reclaim joy. It's never too late to surprise your family and yourself with what's still possible. Try the protocol. Notice what changes. Pay attention to the moments when pain would normally stop you, but doesn't. Count the stairs you can climb, the minutes you can stand while cooking, the hours you can sit comfortably watching your grandchildren play. Your body has been talking to you through pain. Now it's time to speak back to it with healing, and I promise you it's still listening. If you found this information helpful, please consider giving this video a thumbs up and subscribing to our channel. We post new content every week, specifically designed for those of us in our golden years who aren't ready to stop living fully. And if you know someone else who might benefit from this approach, please share this video with them. The greatest gift we can give each other at our age is the knowledge that helps us live better. Until next time, this is Dr. Harold Winters, wishing you comfort, mobility, and joy in the days ahead.